this is Grace. I'm going to be demonstrating how to insert a Foley catheter. So first, I would check the patient's charts and make sure that I'm doing the right thing at the right time and all that. Make sure that it's lining up well. Also check their allergies, just to make sure, because you don't want to put latex with someone who has allergy with latex, for example. And then I will knock and come in. Hello, I'm Grace. I'm the nurse today. We're going to be inserting a Foley catheter. The doctor has ordered it. Have you ever had a Foley catheter inserted before? Oh, you have? That's good. Then you kind of know what to expect. So I have my supplies here. And I'm just going to apply hand hygiene. Okay. All good. And then could I get your name and date of birth, please? Okay, thank you very much. That matches up. We are going to get you set up here. So basically, I'm going to have you spread your legs apart, and I'll help you get positioned, and then I'll put the towel over you until I'm ready. And then when I am ready, I'll have you move the towel out of the way. So, get you all positioned here. We'll set you up a little bit. Is that okay? Okay, good. Is that comfortable for you? Perfect. Okay, so I see that she has a waterproof pad underneath, which is good because we'll want that in case of any drainage or anything happening. And I'm just visually inspecting the area, and it looks good. There's no irritation or anything that I should be worried about, so it looks good. And then she palpating her abdomen, she's not distended or anything, so seems safe to go ahead with the procedure. So I'll have you put your legs apart and put your knees together, kind of. We're going to make a little tent. That looks good. And here's your towel. Okay, and then also, too, before I do the catheter care, I'll want to perform pair care and make sure she's all clean. But she just had a bath, so she's good to go. Oh, before I even take it out, I'm going to want to wash my hands again, just so that if I'm touching it, it's all clean. But before I even take it out, I'm inspecting the package, and even though it's actually open, I'll want to make sure that it's all intact, there's no tears, it's not wet, anything like that, just making sure it looks good. And then checking the date, I guess, to make sure it's not expired. And then one more time at her bedside, I'm checking in my mind, make sure this is the right thing at the right time with the right patient. Okay, so then I'm opening it up. And making sure to not reach over my field, and then grab my gloves. Uh-oh, my gloves are gone. Okay, well, I'm gonna push this off my table because I don't need it. My gloves are gone, so I'm just gonna put these in here and pretend that they're sterile. I must have thrown them away from when I did it in skills. Okay, so start that over. so there's the gloves. Okay, grab them. Really? Okay. Okay. I'm trying to think of how I'm supposed to grab it again. Grab it inside the cuff, right? Mm-hmm. Okay. Okay, so I got my sterile gloves on. Now I will grab the drape. But I don't need this one, that's the cutout one. I need this one. And I want the shiny side down. So I'm going to create a cuff at the top so that when I slide it under her, I won't touch her when I put it under her. And I'm probably going to touch it in the demo because she's a mannequin, she can't really help me. But, you know, if it was real life, I would be careful to not touch her, and if I did, I would start over my sterile technique. So here we go. Could you lift up your towel for me? Thank you. We're just going to slide this underneath you. Okay, so I maintain sterile technique. Now the next step is I'm going to take my box, put it over here. Okay, then we're going to clean her before we put the catheter in. So, and also squeeze out the lube, which I already have, but I would squeeze that out there, and then done with that. And then I would clean her 3 times, once around the edge, once around the other edge, and then one down the middle with a clean swab per each stroke. So once like that. Once like that. And once like that. Alright. I'm done with that then. And I'm gonna maneuver this so I can. Okay, I'm gonna touch the mannequin now, but just because she can't move, just so I can get the legs out of the way. But of course, in real life, if I was touching her, I'd have to restart my sterile field. So, just moving that out of the way, and then I am going to prepare my catheter. First, I will coil it up so that's kind of curvy. And then I will dip the end in some lubricant. Alright. And then put my syringe in so I'm ready to go, but I'm not going to inflate it. It's just so I'm ready to go. Then I will hold her labia open. see where I'm supposed to put it. Hey, you're right, Don. It doesn't want to go in, really.
Mm-hmm.
Okay, and then be sure to let me know if you feel any burning or any pain. And then I'm going to go in till I feel resistance or urine flow, and see the urine flow. And then I would go 2 centimeters farther than that. Oops, I touched the tube, but I shouldn't have. I should keep my hand here all the time. Okay, and so now that it's in place, I'm gonna inflate the balloon. Okay. And then I'll give a tug and make sure that's in there, which it is. And then I'm done with this, so just discard all that. And then I would have a piece of tissue or something and wipe off Paracare, like the extra lube and all that to make sure it looks good. I can take this out. Right. I'm trying to think. I don't have the leg clamp thingy, but I guess if I had one, I don't know where it is. I would, get that all prepared, strap it in securely, and make sure that this has enough room so that she's not tugging on it. And then I would mark the adhesive with the date and time, and then my initials too. Okay, so we're done with the blanket, and I can cover her back up. And then the last thing is to just inspect the bag too and make sure the bag's looking good, no holes or anything, and then hook that onto the bed. Okay, how you doing? Feeling okay? Alright, good, excellent. So, remove my gloves. And perform hand hygiene again. And then lower the bed. I got your call light here, so just call if you need anything. And I'm gonna come back in 15 minutes and see how you're doing. Alright, are you comfortable? Okay, good. And then the last thing I do is record on her charts, that she handled it well. That I put it in, and then I'm done.